My name is Henry Muench. I began my employment with St. Thomas Psychiatric in 1966, but I was located in Windsor at the time because there was a satellite office for discharged patients. St. Thomas at that time still had well over 1,000 patients, and we were serving 5 counties, with Essex County being our largest catchment area, with well over 40% of admissions coming from Essex County. I remember my first visit to Dr. McGregor's office, who was the superintendent, and he was a small gentleman, and his office was filled with, must have been 1,000 files, but I think he knew every patient personally. And he sat me down at his desk, and he pointed his finger at me, and he says, "In this hospital, the patient is the #1 priority." I said, "Okay." I said, "Well, what does that mean?" Well, it meant that he gave me support with all of my projects whenever a patient was discharged. Every week when I came down for referrals, he would insist on getting updates on the patients that were being discharged. And whenever I needed things special, and I'll give you an example of this, he was there for me. There was a time when he was encouraging me to get more families involved in visiting the clients in the hospital. So I would start bringing the families down with me in my car on my weekly trips. Well, after a while, that became too cumbersome and there was too many people. So I started a bus trip, a monthly bus trip, where I hired a Greyhound bus, and I deferred the cost by charging everyone $5, but occasionally there weren't enough people to fill the bus. And somehow Dr. McGregor made up the difference in the money. He was just that kind of a guy. He would give you support. He'd nudge you in the right direction, but he'd let you do your own thing. Unfortunately, in the early 70s, Dr. McGregor was killed in a car accident, and our new administrator was Mr. Jim Wilson. He was quite a different guy too, but he had a very similar leadership style. He was also focused on being responsive to community needs, and so various specialized units were created to serve those communities. Included were the forensic unit, the addiction unit, developmentally behavior disturbed unit, and the addictions unit. And of course, that was a great relief to communities because those were areas that were not previously receiving the care that they needed. Mr. Wilson also had a third priority, and that was staff recognition and development. And to that end, we created all kinds of in-hospital programs to that end. We set up the Quality of Work-Life Committee. We gave education support to people wanting to upgrade their education. We also set up an employment assistance program to help people with any personal needs that they may have. The staff responded well to that. And for example, the hospitals at that time were suffering from very high absenteeism rates. And so one of our programs was designed to kind of, decrease our absenteeism. So we started a special program where you had recognition if you had good attendance. And I can remember one of the things we did, because Mr. Wilson loved food, one of the rewards you got if you had no more than 6 days a year absenteeism was we would have a banquet for those people. And the banquet was just marvelous. It was like an 8-course meal. And of course, the staff responded. Our absenteeism at the St. Thomas Psychiatric Hospital was the lowest of any psychiatric hospital in the province. There was a case when there was a public outcry about a patient who had apparently been in this hospital for years and years and years, and no one had ever talked to him, and he should be discharged back to the community. And somehow it got onto the Bill Brady show, which was a call-in show for people who had complaints. And they called in about this person, and the politicians got involved, and they came down on Dr. McGregor, and Dr. McGregor looked into it, and sure enough, we were kind of at fault. And he called me into the office and he said, "Henry, this guy's a Windsor guy. I got to send him back to you, and you got to help him out." The reason why no one had been communicating with this fellow is because he was Portuguese and he couldn't communicate in English. And but anyways, so I thought, how the heck am I going to deal with this? So I looked around, found a Portuguese church in the Windsor area, brought the priest with me to St. Thomas to pick this patient up, and we brought him back to Windsor. I managed to get him home to live with a member of the church congregation, and I got him a job at the Holiday Inn washing pots and pans. And this was beautiful. Everything was working nice. And about 3 months later, I got a phone call from the Holiday Inn saying, we just want to tell you that this person's benefit package has just kicked in, and part of the benefit is a $10,000 life insurance policy, and he put you down as the beneficiary. And I thought, not bad. But anyways, it didn't sound right to me, so I called Dr. McGregor up, and I said, Dr. McGregor, is this legitimate? And he said, well, he says, it's not illegal, but he said, it's immoral, but I'll leave it up to you. So, of course, I went back to the employer and I said, let's do something different. And I talked to the client, and we decided that the church, who had helped him out quite a bit, deserved that more than I did. So, and that's what happened.